Hello, my name is Angela from Angela Simpson Functional Medicine Physiotherapy, and I'm wanting to talk to you today about hormone imbalances and how they may be contributing to joint aches and pains. And if you are a female that is potentially in perimenopause, or maybe you are just transitioning through menopause, and you're noticing some fluctuations in aches and pains in your body, depending on the time of month where you're at in your cycle, I suggest that you listen in, because this is a common symptom that I see a lot of my patients having. And part of the reason for this in perimenopause is the hormonal levels do tend to fluctuate a little bit more than they did maybe previously in your 20s and mid to early 30s. Often there is some imbalances that can either be certain hormone levels too high and certain hormone levels too low at different points in the cycle. And for females, a lot of times the joint pain actually has to do with imbalances in estrogen levels. And so for us, we really need just that right amount of estrogen in our bodies at any given time in our cycle for our joint system to be happy. And so for women that notice they have symptoms in the back half of their cycle in regards to more joint pain, often this can happen if the estrogen levels are potentially too high, or they are too high relative to the amount of progesterone in the body, which sometimes can be too low, and this is more obvious in the back half of the cycle. So if you are having symptoms around your cycle, a week to 2 weeks leading up to it, and it does cause you some aches and pains in your joints, possibly around your pelvis, but maybe even further out. It could be in your knee, it could be in your shoulder, could be causing you to not be able to move your body in the ways that you normally would like to. It is really important that you learn about how to address this, because if your hormone system is out of balance and it is causing joint aches and pains to the point that you're not able to move your body appropriately, this can become quite a cycle, because it actually can create more hormonal imbalances if you're not able to exercise regularly due to joint pain. And on the flip side of this, sometimes in perimenopause, especially as you're getting closer to menopause itself, you actually can have just overall lower hormonal levels with estrogen, potentially progesterone, and some other hormones as well. And if the estrogen levels get too low relative to what your body needs, this also can actually cause joint pain. Estrogen actually does lubricate the lining of our muscles, our joints, our tendons, and this actually does help to keep our joints happy and working correctly, and keeping them relatively pain-free, especially as we age. And so it is normal for our estrogen levels to gradually decline as we age, especially as we're getting close to or moving through menopause. But if they are lower than they should be, it's quite possible you might be struggling with some joint symptoms. And there are ways to treat this. And if you are noticing this, and you have been noticing this pattern for quite some time, it probably is affecting your life in several ways. It's probably affecting your ability to get out and exercise. Maybe it's even affecting your ability to socialize, or even just interact with your family if you are in a lot of discomfort, especially at certain times of month. And so it is important that you address this. And one other thing that can potentially happen if your estrogen levels are out of balance relative to your other hormones, especially as you get closer to or go through menopause, is you potentially can be at higher risk for things such as bone density issues, which can lead to autoimmune conditions such as osteoporosis. That can even lead to other types of non-favorable estrogen-related conditions such as female cancers. And so you really want to be able to learn about your current estrogen levels, especially relative to your other hormone levels. What are they at the key times of month when you are feeling more symptomatic? And what are the ways that you can rebalance your estrogen levels so that you not only have less joint pain, but you actually are less susceptible to some sort of chronic condition developing either in the near future or as you transition through or later in your lifespan through menopause. And there is a solution for it, and it always does involve looking for the root cause of why your estrogen slash sex hormone system might be out of balance and might be causing your joint pain. And there's various different reasons for this, and the solution is going to be individualized to you. And there are some really key diet and lifestyle strategies that you can take to help get these systems hormonally back in balance and to get your joints feeling better again. And so if you do want more information on this, if this does sound like you and you are worried about not only now but the future, and how functional you'll be, please let me know, because I'm happy to have a free 45-minute consult to talk to you about this and see if working with me to teach you how to rebalance your hormones and also actually help you with your joint pain, both now and over the long term, is a good fit. Just let me know. You can reach me at my website, www.angelasimpsonfunctionalmedicine.ca, and I hope to hear from you soon. Thanks.